diagnostic assessment interview at choice. In our program, we like to call them mutual knowledge interviews between the client and us as an institution. The purpose of the mutual knowledge interviews or diagnostic evaluation interviews is to understand the current situation of the person who comes to us for help, and through these interviews to determine whether a program like ours would be the most suitable or convenient option for this person and their family who are in need of support. The first interview is generally the initial interview. In the diagnostic evaluation, although I say generally because sometimes the first interview cannot take place since the person who comes to us for help is the family, because the family member does not want to receive that help. In this case, the interview is called an orientation interview, where a facilitator specialized in family matters will listen to the request for help and guide them so they can make a decision to resolve the conflict they are facing. When we talk about the first interview, we know that it is the client who carries that difficulty or the problem they are experiencing. It is important to keep this in mind. The first interview is always with the client who has the problem. Once the first interview is conducted and we agree with the person who came to our listening space that we will have a series of interviews, we begin evaluation stages, which I will describe, though not necessarily in the order in which they are presented. Family interview. The family interview does not include the client who carries the problem. The family interview is a space where parents, siblings, partners, children, or any significant person in the client's life whom the client wishes to include in their treatment are invited. In that meeting, the choice facilitator will aim first of all to identify how the family is positioned regarding the conflict their relative is experiencing, to ask about authority within the family, whether someone holds it, and if so, who that is, to inquire about the family history, important episodes they feel are necessary to share with us, and whether they are willing to participate in the family spaces offered by choice. It is important for the family counselor to know all the schedules and days for the family groups, including couples groups, parent groups, sibling groups, or network groups. Because this information will be communicated to the family, and they will also be told that once the evaluation is complete, after all the meetings have taken place, the same professional who conducted the first interview will arrange a feedback session. Next is the structural interview. This interview consists of the counselor asking the client about their current lifestyle and daily routines. Questions include whether they work their work hours, when they start and finish, what they do on weekends, who they live with, whether they play any sports, if they have any hobbies, how they manage their eating habits, whether they study, and other matters related to their regular activities. It should be noted that, in general, when we conduct an interview, counselors often find that the client has a lot of idle time and, in general, has also stopped doing everything they used to enjoy, right? Things they used to feel like doing before they started using, such as studying, sports, or hobbies, with substance use now taking the place of those activities. It can also happen that we encounter people who still maintain some kind of structure, right? Such as work or studying, and even, many times, some non-regular activity, a hobby, a sport. All of this will guide us in understanding how substance use has affected the person who is coming to us for help, how it has impacted them, which areas they have been able to maintain, and how to tailor a possible support plan by understanding the client's dynamics. After this interview comes the psychiatric interview. The psychiatric interview is essential in order to begin formal treatment at our institution, since the medical direction of our program is responsible for submitting the treatment recommendation to health insurance providers, whether union-based or private. In addition to being an administratively necessary interview, it is also an interview that determines how our psychiatrist views the prospective client. And in fact, after discussing with the team, it is the psychiatrist who advises whether the treatment we offer is the most appropriate at that time and for the situation of the client who is coming to us for help. Many clients come from medical treatments with prescribed medication, and others leave residential institutions also with a medication plan that was indicated for that stage of their hospitalization. Therefore, the valued clients of choice will have the comprehensive medical support of our psychiatrist to carefully review those treatment plans and make necessary modifications or adjustments to the same plan whenever it is deemed necessary. We say that in the first psychiatric interview, We ask patients not to request any changes to their medication plan or to have any medication prescribed, because until they are admitted to the program and have received feedback from those interviews and evaluations, it is not advisable to prescribe or modify a medication plan. This is because we would not be able to provide the appropriate follow-up if the person does not enter the program. We continue with the psychological interview. This is an interview that aims to gather all the information related to the history of the person who is coming to us for help. For example, whether they have had previous treatments, what drugs they have used or are currently using, at what age they started using, if they have had legal problems, or if they have had any accidents due to substance use. We ask them about their education, whether they work, if they study, and who they live with. We ask them to tell us a bit about their family, to create a family genogram, and anything else related to their personal history. Next comes a group evaluation. The group evaluation is recommended most of the time, but not always. There are clients with whom we see a clear rejection of the idea of being grouped together, and therefore we do not force them, even if they meet the criteria, to be in a group. However, most people who come to us for help accept that the best suggestion we can give, based on our experience, is to accompany what they are going through with a group format. There is nothing more powerful and effective than addressing problems related to drug use or addictions through group work. Once all the evaluations are completed, the person and their family are invited to a final interview, which we call the diagnostic feedback interview. In this final interview, we explain how we saw things, what we suggest, and what we recommend regarding whether or not to pursue treatment, whether with us or elsewhere. It is very important that everyone who is willing to join the treatment comes to this interview, since much of what will be discussed in that space has to do with how the therapeutic process is carried out, what kind of support structure we will provide, and what our suggestions are at the beginning of that process. It is important to mention that all clients who are going to be admitted into treatment at choice must sign a consent form regarding the treatment being offered, making it clear that they are doing so of their own free will, not because of family pressure, but because they choose it and accept it as it is being presented to them. This is a fundamental requirement for admission into our treatment program. Thank you.